Hi, my name is Jonathan Guzman. This is my video for the Howard University Doctor of Physical Therapy application. I want to be a physical therapist. First, it started as an interest, and I contacted a couple clinics to see if I could volunteer and observe, and after a few weeks at one of the outpatient clinics, I fell in love with the profession. I loved how you're working one-on-one with patients, helping them through their injuries, their pains, whatever the case was, and how appreciative they were of their recovery, or after a couple weeks they felt so much better. I saw how much of an impact that made in the patients' lives that it inspired me to pursue the profession as a career. I chose to apply to Howard University's Doctor of Physical Therapy program because of their location. Obviously, it's in the DC metro area, and I'm very familiar with that area because I grew up in Northern Virginia, so I know a lot. I know my way around DC. I know about Howard, and number one thing that attracted me to the university and its program was that they're very focused on working with diverse populations, in which that's what I want to do. I want to help provide service to other populations, like the populations that don't have health insurance. I don't see why they can't, have that physical therapy service, and I want to be able to provide that service to them. PT school and undergraduate education is totally different from my understanding. I know that PT school is a full-time commitment. Going to school full-time and working full-time, I know I won't be able to work and go to school full-time during PT school, so I know that I'm going to make a full commitment to PT school and make it my number one priority. And I also know that the curriculum is more detailed, more in-depth, and way more intense than undergraduate studies, and I'm prepared to take that on and be successful in it. One conflict that I helped resolve was at work. The therapists were not following proper paperwork protocols, which was causing tension between myself and the therapist. And what I did was called for a meeting and discussed who the protocols and how to follow them, and who performed the task, and what sections they did and what sections I did. And then after the meeting, that was resolved. Being late to class or missing a submission deadline will be punishing myself, because it will make me miss valuable classroom time, instruction, and it will only make me fall behind with the rest of my class, which will keep me from reaching my goals as being a physical therapist. Some of the attributes that I would bring to the physical therapy profession is being very compassionate. I try to understand the patient's feelings and what they're going through, and I encourage them to keep with the rehabilitation programs and try to explain to them that this is one day at a time and it'll only get better from here. I'm also a student of the profession. I strive to do research and learn as much as I possibly can of the profession and what's out there. As a physical therapy aide, I always ask the therapist questions of why we did this exercise and why they did this modality, instead of just accepting that that's what was done and that's it. I have extensive experience in the field of physical therapy through outpatient therapy and sports medicine and inpatient clinics. I also have learned from various physical therapists and in those settings. I have a passion for the profession and for the patients. Through my passion to help them through rehabilitation is what will make me successful as a physical therapist. Thank you so much for your consideration and watching this video for my application. I look forward to hearing from you.